Growing Pains, Mental Health and Mississippi's Children.
I think there was issues in high school that we just dismissed it as being young and immature.
When I started talking to him about it, I discovered that he was hearing voices.
It's very easy to blame oneself even more and start second guessing everything you do and think, well, maybe I'm not spiritual enough, maybe I'm not trying hard enough.
We put it in the closet in the church because we don't know how to deal with it.
And now, Dr. Rick DeShazo and Melissa Faith Payne.
Mood swings, difficulty concentrating, or abusing drugs or alcohol, all common indicators seen by family, friends, teachers, and doctors when mental illness in a child is suspected.
On this program, we'll discuss how doctors diagnose a mental illness with our panel of health professionals.
And the role religion plays when parents reach out for help.
And we'll hear from parents who deal with these challenges. But first, what are the symptoms of mental illness in children?
It may be something that you were born with. It may be, for example, in the area of depression. Some individuals just don't have enough of the neurochemicals. Serotonin is a big offender. They don't have enough of that to make them feel happy most of the time.
According to the Mayo Clinic, identifying the symptoms of mental illness in children can be challenging. Sometimes symptoms go unnoticed and kids slip through the cracks and go untreated.
It may be that it doesn't become apparent until they're older. Some of the mental behavioral disorders occur early in life, but many of them start presenting around puberty and then in the late teen periods.
Symptoms to look for include changes in mood or behavior, having trouble concentrating, weight loss, intense feelings, physical harm to themselves, and substance abuse.
He was having difficulty just focusing, like on doing his homework when he'd come home, or focus on when we would be talking to him about things. He'd be, tuned into something else. And then I confirmed it with the teachers. And as we look back on it, I think there was issues in high school that we just dismissed it as being young and immature and, just not making good decisions.
Debbie and Larry Waller had been dealing with their son's mental illness since he was in grade school. Michael was being treated for ADHD, but things changed when he went to college.
We sent him off to college, and he, that first semester we thought he was just like other kids, kind of playing. Come to find out he didn't go to any of the classes. He was in a dorm room playing video games all day.
What are the symptoms and how do medical professionals arrive at a diagnosis of mental illness in a child? Joining Dr. Rick DeShazo are Dr. Timothy Summers, Dr. Susan Buttress, and Dr. David Elkin.
We're talking a little bit about the diagnosis of behavioral disorders and mental illness, which we could call several different things: mental health, brain wellness, however you want to, however it's most comfortable. So, what are the symptoms that should alert folks that they need to get some professional help, and how do you go about diagnosing these disorders?
It's such a diverse range of problems, it's difficult to say. But what we're looking for mainly is variations off a normal developmental track. We have expectations for our children and teenagers on what they should be doing. And we want to keep those expectations wide. When they start having difficulty with some of the basic things in life, like sleep, appetite, learning, relationships with peers, relationships with parents, we start seeing changes on some of those things, I would want to ask more questions and get them seen by someone who knows what he or she's doing.
So I hear relationships. Is that a big part of this?
At home with parents, many times that's the first issue that becomes apparent, is that the parents don't feel like they're developing a relationship. They can't get the child to behave. They can't get the child to respond. It may be We know there's a broad range of behavior in children. So you may have a very passive child who does everything the parent asks. You may have a very active child and who is up and into everything. And that child may be normal too. So you want to make sure not to think that differences are always abnormal, but significant differences that move across the spectrum may make a big difference and may make adjustment difficult, not just at home, but in child care or in preschool.
Okay, so Dr. Summers, how do you diagnose these disorders? How do you end up labeling someone? And I presume you have to do that to select treatment. Is that the reason that you go through the diagnostic work?
Absolutely, because you're only going to be effective in treatment if you make the correct diagnosis. And my diagnostic process starts with understanding the origin of the child from the time that their mom conceived to the delivery process and schooling and et cetera, et cetera. So if children start school off initially and they're having problems with learning, well, children shouldn't have a problem learning in kindergarten and first grade, but if they do, then that's a sign that there's something going on that has been going on for a long time. So a number of problems children have, they're problems that have existed for a long time, or they may be something very, very acute. Something very acute could be changes in attitude, changes in interest in school, changes in their relationship with people, feeling unhappy, feeling sad, not feeling good about themselves, feeling like they don't fit in, feeling as though they're not good enough, feeling unaccepted by peers, not getting along with parents. So a lot of times when a child comes to see me, they're using drugs, they're sexually promiscuous, sometimes they're engaging in some criminal behavior. At times they'll be engaging in the criminal behavior may be in the service of obtaining money to buy drugs. A lot of times the children, they'll stop going to school because they'll be pessimistic about what they can do. They don't believe, they don't like themselves, they don't believe other people like them. So they end up being very sad, being very depressed, which frequently will manifest itself as anger.
Parents and teachers are usually the ones to spot the first signs of mental illness in children. But they may not see the symptoms, and children may not be able to express themselves if there's a problem. A doctor or a mental health specialist watch the signs and symptoms in a child, then a diagnosis is given.
I noticed when my son was 2 that he was different. I saw him kicking. I saw him butt head into a wall. And by the time he was 5, he was angry enough to talk about burning the school down, and I started trying to get help.
Sharon Townsend says her son Damien showed warning signs when he was very young.
I cried for 2 weeks because I've dealt with bipolar people, and I knew that it was not going to be an easy road, and it hasn't been.
Psychologist Joy Hogue of the parent advocacy group Families as Allies says parents sometimes avoid getting help for their child because of fear.
Parents, and especially moms, tend to automatically kind of have this guilt gene where they blame themselves for everything that happens with their child and always second guessing themselves. And then if there's mental health challenges on top of that, it's very easy to blame oneself even more and start second guessing everything you do and think, well, maybe I'm not spiritual enough, maybe I'm not trying hard enough. And then oftentimes when parents do try to find help, the first questions they're asked sort of imply, well, what did you do?
Who can make a diagnosis of a mental illness for a child?
There's a whole spectrum of folks out there now who are doing mental health counseling and so forth. You've got psychiatric social workers, you've got clinical psychologists like yourself, you've got pediatricians, you've got psychiatrists, you've got psychiatric nurse practitioners, and you've got licensed counselors from religious organizations and other places. Who really can make a diagnosis of a psychiatric disorder?
So what we'd want to make sure of is that no matter how the person is trained in terms of their degree, if they're a psychiatric social worker or a psychologist or a psychiatrist or a pediatrician, are they using the same system of diagnosis? And in psychiatry, it's the DSM-5, the Diagnostic Statistical Manual, but it's more than that. Are you doing good interviews, as Dr. Summers mentioned, talking about their history, their development, their family? Are you doing good medical workup, like Dr. Buttress does? Are you asking good questions that in a sense have become standardized within our field?
And you have these standardized tests, the psychometric testing, and is that done at the pediatric level or clinical psychology? Who can do that? And what is it?
So a lot of these standardized tests are self-report, meaning the child will answer the questions. Many of them are parent report, parent or caregiver answers the questions. Teacher report, a bunch of different people answering questions about the child or the teenager. That can be done in a variety of settings, in a pediatrician's office, in a psychologist's office.
These psychometric tests have been done in thousands of people and looked at statistically. Is that the way they work, to sort of figure out if you give these questions, you probably got this and this and so forth? Is that
right? Right. So not just looking at intelligence and academic achievement, but also looking at mood and behavior, internalizing features, anxiety or depression, versus externalizing features, that aggression or anger or oppositional behavior are all scored, and so the examiner looks at these, and that is a piece of the puzzle. It's not all of the puzzle. The interview, the watching the patient, looking at where the symptoms are, they should pervade across a child's entire life, not just at home, not just at school, but socially, emotionally, everywhere. And so to make sure that the diagnosis of something like ADHD isn't made if the problems are only at home and they never occur at school. There must be something else.
When you have a diagnosis made, frequently a part of that diagnosis is how you respond to treatment. And people are used to going to primary care physicians who say, well, I'm not really sure which of these disorders you have. It's probably a pneumonia or bronchitis, or you got a fever, maybe it's a urinary tract infection. I'm going to treat you with this or that and see how it responds, and if it responds, then that'll help confirm the diagnosis. Is there that kind of trial and error in mental health?
Well, frequently it is. In mental health, generally, the reason that the person comes to see you is really only the symptom of some underlying problems. Now you have to play detective and figure out what those are. So we have a lot of very confident people who do an excellent job from the diagnostic perspective. At the same time, one of the problems we have is that we don't have enough of them, and the other part of the problem is that generally treaters have their own morals, values, systems of beliefs, and sometimes the people who make diagnoses are not culturally sensitive or aware of the history of the people that they're serving. So that's a big problem.
There are verses in the Old Testament and in the New Testament where it talks about evil spirits or unclean spirits taking over people, and when either God or one of the prophets, or in the New Testament when Jesus spoke, the unclean spirits left them and they were healed. There is some interpretation there as far as what mental illness can be. Whether it's an unclean spirit, whether it's a personal demon attacking somebody. I think the key to take away is a lot of people use the Bible, and this is when it gets a little dangerous.
Toby Riley is a licensed professional counselor at Crossroads Christian Marriage and Family Counseling. He says he's seen families facing mental issues with their children turn to their faith.
A lot of the families that come to me looking for more of the spiritual side, they are looking for more of the comfort, the how do we deal with this. Sometimes they're a little more accepting that this might not be a perfect solution that we're not going to, fix a child, but it can make things a lot better. It can show them how to deal with this. I still see how some families that do go to pastors tend to go more for, this is what I'm going through, this is the support I need, not as much I need treatment or how do I get rid of this, it's I need support through this.
Well, the first thing I let them know that, listen, it's okay. It's not about you. You haven't done anything wrong. It's not a punishment. Don't look down upon yourself or your child as having been punished by God, as a part of this. It happens. A lot of times I find parents who are feeling very, very guilty themselves. They're looking at themselves. Did I do something? Am I a poor parent? If my environment was better, would this child be better?
Bishop Ronnie Crudup of New Horizon Church International in Jackson says at least 2 to 3 people approach him each month to get help with the challenge of a child having a mental illness.
Parents are so anxious and needful, in relationship to this, that and desiring a quick fix. And that is the thing that is different about mental health issues. It's not going to be a quick fix. It's not like, you cut your finger or you had something that you could take a little medication, it will clear up. I tend not to use the healing language with people when it comes to mental health issues. We talk more, use a little bit more therapeutic language with them than the healing language, because more than likely this is something they're going to deal with over the long haul. You can't just pray it away. You can't just rebuke it away. Exorcise that demon. It doesn't work like that.
Bishop Crudup says he speaks about mental illness to his congregation, but some pastors avoid the topic. According to a survey of 1,000 Protestant church pastors by Lifeway Research in 2014, 66% of the pastors either rarely mention mental illness to their congregations, mention it once a year, or not at all. 26% talk about it several times a year, 4% speak about mental illness about once a month, and only 3% mention it several times a month.
And it is a problem that needs to come out of the closet, okay? We put it in the closet in the church because we don't know how to deal with it. We're afraid of it. And our inability to deal with it well honestly causes us to avoid it and not look weak in terms of it. And I don't think that we're serving our congregants well when we don't address the issue.
What should the parent expect if you go to see a health professional with a problem, and how do you get your kid to accept the care that's offered?
Well, the parent should play a huge role. They're a huge part of that child's life. It depends on the age, though. If you have a teenager and the teenager is over 15 or so, then often the teenager is able to make the choice as to whether or not the parent is involved in the room, whether or not the parent is privy to everything. And in honesty, we all know that a teenager often is not going to disclose everything that's going on with them in front of the parent. And so it's important to give that teen or even preteen some time for interview without the parent. Of course, the parent needs to be involved, and so many times in the interview process, one thing that we do in our dyad when we're interviewing together is to watch the interaction between the parent and the child. Very important to see what the parent does when the child looks anxious or distressed. How does the parent respond to the child's request? Is it appropriate? What's going on there? And then certainly in a therapeutic context, I know both of you will agree that the parent needs to know what's going on, not so much verbatim if they're pulling a teen aside for therapy, but to know what the plan is in general. In a child, a young child, it's really important for the parent to watch the therapist when they're working with the child as to how they respond to the child. There's a sort of new form of therapy called parent interactive training that is teaching parents how to interact with their child, how to have positive interaction, not just how to discipline the child, but how to reinforce the right kind of behavior and how to have good interaction with that child rather than just be the disciplinarian, but somebody who's really learning how to care for that child.
My name is Pat Montgomery, and I have a child that was diagnosed with schizophrenia at the age of about 17.
Pat Montgomery and her son Ryan have had a long battle with mental illness. Ryan was a good student, an avid runner. He was an artist, a band manager, and in the choir. But after the death of his older brother in a house fire and the death of his father, Pat started getting concerned.
At the very first, he had an issue in the choir. He had gone on a choir trip and separated himself from the choir, and that was very unlike him. Then he had trouble in school. He was having problems focusing in school, and his teachers were telling me that he was sitting in class and they didn't really know what he was doing. And when I started talking to him about it, I discovered that he was hearing voices, and that's how we found out. That was really scary. He wasn't able to keep up in school. We had a meeting with his teachers, and we kind of got on the same page, and we tried to get him in an education program where he could get his GED. He wasn't able to finish high school, and he had quite a few hospitalizations between the time we found a good treatment for him.
Pat says she went through many years of trial and error treating Ryan.
We put him on some antipsychotic medicine, but none of the medicines that we tried worked. I worked in mental health, so I thought when this happened, I thought, well, this is gonna be easy. I did feel like I would know what to do, but I didn't know what to do. I was just going from person to person, because it was like the way that I felt, if you can imagine a woman with her hair on fire running down the street just saying help. That's how I felt, and that's what I was doing. I was talking about it to everybody that would listen.
What are the behaviors that separate something that's urgent from something that's emergent so far as getting your child in to see somebody?
Let me start off by saying I think there are different categories depending on the age of the child. So starting with a young child, failure to make progress on developmental milestones. Dr. Summers mentioned speaking, walking before that, crawling, learning, trying to engage, a child not wanting to make eye contact with someone. And that's her area in a big way. And as the child gets older, maybe changes in terms of moodiness, inability to control temper and anger and acting out, impulse control problems. And as the child gets even older, I think most parents and teachers grow concerned when they see a child who's doing well, perhaps in school with friends, and suddenly the grades slip a good bit, or they pull back from friends, or the things that used to interest them no longer interest them.
So a change.
A significant change. She mentioned, over in the ditch in a sense, but a significant, not just a shift, because teenagers, good grief, they're going to be all over the board on a lot of things, but a major shift. If I were a caregiver or a parent, I would start paying attention to those things and wondering what's going on here.
So teenagers are a special issue because of all the changes that are going on in them biologically and otherwise. They do change rapidly, and their moods change rapidly, and their behaviors change rapidly. So how do you tell a normal teenager from an abnormal teenager?
I want to hear this.
Well, you know,
Does it have to do with function, whether they're functional or not? Because some of the most abnormal teenagers I have met function within their group whose behaviors are abnormal. So they can be functional in an abnormal way, but I'm not a psychiatrist.
Well, you know what I look at, what's very important to me is, are you making decisions that result in good things happening to you? Or are you making decisions that result in bad things happening to you? And if you are making decisions that result in bad things that happen to you, are you doing that repetitively over and over and over in spite of adverse consequences? That's a very key element to me. If you have a child who's not able to control their impulses. If they see something and they want it, they take it and they do it. Mm-hmm. If they're not able to be satisfied with an orange when they really want an apple, that's a significant sign to me. If they frequently complain of not feeling good, or if they feel a need to engage in antisocial behavior in order to feel good, if they that's a big sign. If they're hearing voices, seeing things, if they are using drugs, if they're drinking, if they're not doing what their parents tell them to do, if their mom tells them to go and do their chores and they don't do it, if they go out and stay out all night, if their parents set structure and guidelines but they don't adhere to them, they're supposed to be in at 9 but they stay out until the next day, or they'll leave for 2 days. You know, so those kinds of deviations from what we consider to be normal. You know, ordinarily, everything is kind of like appropriate for your particular stage.
All episodes in this series on mental illness in children are available on the PBS video app or on the MPB YouTube channel.
Go to mpbonline.org for web extras and more discussion about children's mental health.
For all of us here at Southern Remedy, thanks for watching.
Southern Remedy is underwritten by a grant from the University of Mississippi Medical Center.